live.
Good afternoon.
Hello.
I'm Paul Formica. I'm the state senator of the 28th District. The 28th District, which includes a portion of Old Saybrook, Old Lyme, East Lyme, Waterford, New London, a portion of Montville, Basra, and Salem. Thank you very much for joining me this afternoon on Facebook Live. We'll be here for the next 55 or 60 minutes or so to answer all of your questions that you have sent in to the extent we can, or more specifically to be a conduit or a resource or a guide for you so that you can find the answers to the questions. My email for any questions that you may have and my website are available, senatorformica.com. Any questions that you may get generated by you as a result of this hour and we don't have the answers for, please feel free to go to senatorformica.com. All of these links to the information that I'm talking about will be available on senatorformica.com. And my email is paul.formica@cga.ct.gov. I have great staff helping me out with this. I'm a little technically non-savvy, so I'm doing the best I can with this, and I think we're going to do okay. And I'm sitting in my house on my kitchen table, kitchen counter, much like many of you are sitting there, and watching my hair grow and my nerves. So we're doing the best we can with what we have. But I can tell you that with communication and collaboration together, this is something that we are going to overcome. My dad used to say, "This too shall pass," and it will. I'm very privileged today to be joined by Dr. Situ Vora, who is the Chief Medical Officer of the Mashantucket Pequot Tribal Nation. He's also, I believe, a pulmonologist, and he's very versed in all of these things that are going on right now regarding the virus that attacks us here in our lungs. So I've asked the good doctor, who is a friend, to come on and reply to some of the questions that we have gotten previously. A number of you, thank you very much for sending those questions in. I'm going to turn it over to Dr. Vora now, and he's got a list of the questions regarding the medical conversation that we're going to have, and not about the virus. He'll talk about that. And then I'll go into more of the economics and those questions that are coming on. And I don't know, Doctor, we'd be able to stay with us for as long as you know you're very busy.
As long as we need to, absolutely.
So thank you for being here, first of all. And I know you have the questions, but let's start with warning signs. What are the warning signs, and what are we supposed to be looking for or be mindful of?
Certainly. So the warning signs, the most common ones are a dry, severe cough, along with fever. And subsequently, in a small number of people, it also has increasing shortness of breath. So it's certainly, these are the three main cardinal symptoms. There are some minority of patients, small number of patients that may have some additional symptoms, such as severe fatigue, body ache. In some cases, they may have loss of taste, smell. They may even have some nausea or diarrhea in a very small number of patients. But by and large, the three cardinal symptoms, the main symptoms, are severe cough, fever that is persistent, and increasing shortness of breath. Now, to remind our audience that for the majority of the folks who are infected with COVID-19, the SARS coronavirus 2, they will do just fine. And they will have symptoms that will dissipate. Many of them may not even have too many symptoms. But the folks who end up requiring medical care typically have these cardinal symptoms that we talked about.
Okay. So that's good. That's the first step. And then we've had a number of questions that I believe I've forwarded to you. You want to just take it from there? I don't think it's
Sure. Certainly.
have a conversation.
Yeah, one of your constituent had the question, what's the current outlook? Has this peaked yet? And I think most of us, who consume media in different forms, know that we are not at the apex or the peak of this pandemic in the Northeast just yet. For the state of Connecticut, especially Eastern Connecticut, the projections are in the second two weeks of April, April 15 to 30th, we might see the rise of the cases, partly also because of the fact that the testing apparatus testing is getting a little bit more available. So we'll see more number of detected positive cases. What I would really focus on would be the actual number of patients hospitalized due to the coronavirus, because that's the hard endpoint. Like I said, majority of the folks will have self-limited illness that they can take care of at home, but a small number of folks will end up requiring further care in the hospital. So keep an eye on the number of hospitalization as a good measure of the intensity of this pandemic in the Southeast Connecticut. Couple more weeks to go at least, perhaps even longer for the peak.
Okay, and then so it's important to continue the social distancing, to try to stay 3 to 6 feet away, to try to do all of the things that we've heard about.
Certainly. And it's not just about the individual, right? It's about the act of self-isolation or quarantining is an act of love, because essentially you're not spreading it inadvertently to someone else, especially if for the small number of people who are asymptomatic carrier. So it truly is the way to bring down what the specialists, the experts call it the R naught, meaning what's the spread rate, right? So if I'm infected, the coronavirus is a very easily transmissible virus. So on an average, one infected person can spread it to 2 to 3 other individuals. And then it can multiply since then. By putting strong social distancing in place, and by strong, we mean not even having neighborhood parties or, inviting folks over just for a quick bite. No, just purely a household unit stays together as one unit. And the strength is as strong as the weakest link. So if you have one member who is in healthcare and going to the hospital, it behooves that person to really take precaution of making sure they're pristine clean before they re-enter the home. So yes, social distancing is key to making sure that we slow down the spread of the virus, right? Our main goal is not to overwhelm our healthcare systems and allow them time to take care of those individuals who end up being sicker. Remember, 85% of individuals who are infected with coronavirus will not need any additional severe care. But for those who do, you want to make sure that the hospitals are not overwhelmed. And our act of social distancing helps do just that. It buys us time for the healthcare system to be prepared.
And I've been in contact with our local hospitals, and they seem very prepared and they're ready. There are some local hospitals with some patients in them now that are active with the virus, but for the most part, here in southeastern Connecticut, we're not seeing much of that. But we expect, as you say, to have that ramp up. But
yes,
say that
we're seeing increasing cases, popping up in the hospital. We've had at least one mortality in New London County. It's every single person is valued, and we hope that the overall damage is low, but we should prepare for the peak as well.
so. The peak in the next few weeks. What else? What other questions? So we know that the peak.
So one of your audience had asked the question about what guidance can you offer to people who may have been exposed but are showing no symptoms? And that's a great question. What I would suggest is follow the simple rule that, God forbid, if I'm exposed, do I want to spread it to someone else? So if I'm exposed to someone who may or may not be positive confirmed, the next step for us to do is to essentially be in a self quarantine, meaning you monitor your own health and well-being, check your temperature if you can, if just not subjectively, maybe a thermometer if you have one for your own individual personal use. Do not share thermometers, obvious things. Um, and just lay low for 14 days. That's
And
the simplest way to do it. On an average, the median incubation period is about 5 days. So from the time of exposure, majority of the folks have the onset of symptoms in about 5 days. But we stretch it out to 14 days to take care of those late bloomers as well.
and so the 14 days, so if I have symptoms in 5 days, and then will I go through the virus and be done with it in 14 days pretty much? Or when am I contagious again?
So that's a great question, Senator. And so as long as someone is symptomatic with an actual coronavirus infection, they are shedding the virus in their space by talking, coughing, sneezing, laughing, all those type activities. We saw the case study of a choir out in the Pacific Northwest, and they had significant transmission just from people singing in the choir when someone was pretty sick and did not need to be there.
Because of
So I think
the droplets are going to come out and they're going to infect while you're.
correct.
And
Correct. So the whole idea is for someone who is not feeling well, do not go out so that you protect your own systems and others around you. And certainly if you're coughing with even allergies around this time of the year, if you're coughing or having symptoms of sneezing, it's a good idea to stay home if you can. Or if you have to be out for like a medical appointment or essential shopping, just wear a protective gear, like a homemade bandana or a turtleneck to cover your own cough and sneeze.
anything to contain it, because I was told that we are the carriers of this. If we pick it up on our fingers and we bring it to touching our face, we bring it to our mouth, our nose, whatever, and it needs our hands to kind of move it up, or it needs to be able to be ingested through the air, as you said.
Absolutely. And as you described, Senator, the main mode of transmission is person to person, mostly through droplets, meaning secretions of the respiratory, upper respiratory, by coughing, sneezing, and such. The second mode is if we touch surfaces that are contaminated, and then we touch our eyes, mostly the nose or the mouth. That's the portal of entry for the coronavirus in. But clearly the virus dose is more if you are in presence of someone who's actively coughing or symptomatic.
So if you're coughing, you want to get them out of the workplace, get them away from people, so that they're not infected. You don't want to take the chance. I was told also that sipping warm water every 15 or 20 minutes as the virus sits in your throat, or gargling with vinegar or salt water, or mouthwash or anything. Any of those, they're probably all good to do, but
Yeah, I think, clearly we don't have enough of, randomized controlled trials to suggest if that approach is scientifically proven or not. But clearly, saltwater gargles have been used for ages, right? So it can't hurt. So I would say if it is your normal practice, do it. No harm in it. Yeah.
We're worried about how long the virus stays on surfaces. One of the questions is, are we worried about going to the grocery store and picking up a box of cereal, or
Right.
go somewhere? Does ultraviolet technology kill this virus? And are we worried about getting this virus from touching other things that other people touch?
That's again a good question. The best way of preventing that is not to go out, obviously, but if we had to make that Costco run or go to the Stop and Shop, certainly minimizing touch points and close proximity with our other neighbors in the store is the way to go. As far as the boxes of the goods that we purchase are concerned, use common sense, right? So we can't really Lysol or or wash them down, but certainly, wiping them down as best as we could, making sure our own hands are protected by the solid hand washing with soap and water, warm water for at least 20 seconds, and more frequent use of alcohol-based hand sanitizers, even while you're shopping and after you're shopping. That would be the way to go.
Then you sing happy birthday when you wash your hands. That gives you about 20 seconds, right? That's what I was told. And
Sure does.
and,
Pick a tune, any tune.
we'll hopefully get out of this and we're going to have many happy birthdays. But, the last question that I think people have sent in, and I don't know if anybody is sending us questions now, that certainly we'll try to answer if we can. But if not, we'll get back to you, or send me an email and we'll get back to you through the great staff that I have monitoring this. But what else is there any tips that you can offer? What do you do? You're mindful and professional in all of this. What are some of the things you do to keep yourself safe?
Right. So that's what are some other, besides hand washing and social distancing, can I do anything else? Right. And so the real interaction is between three different things. It is the virus, it is the person, and the environment. And it's the combination of the factors related to all three different entities that decides why someone may get a little bit more sick as compared to someone others exposed to the same virus. So we look at our immune system, and our immune system is a double-edged sword. We need that to fight off the virus, but at the same time, the immune system also can go overactive mode and cause some damage as well. So if we had to really improve our immune system so that either we do not get the infection, or if we get the infection, we are able to handle it much more robustly, there are 7 simple steps that are recommended. Number 1 is to make sure that all of us, especially in these times of stress and anxiety and nonstop social media and other access to devices, all of us need to make sure that we are getting at least 7 to 8 hours of sleep at night. Sleep is a powerful immune system supporter, more than any of the over-the-counter vitamins and supplements that we would pay a lot of money for. So sleep is number 1. Second is to make sure that we have, in spite of not having enough access to grocery stores, to have at least a sensible, balanced meal. Not eating processed food too much, even though sometimes that's the only thing available, especially if the pantry is running low. But to be mindful and find ways to eat a more balanced meal. Making sure you're well hydrated. Dehydration, again, as the senator mentioned, the mucous membrane get dried up, allows easier access to the virus. Stress management. We know for sure that if we are in a state of constant anxiety and high stress, which most of us are these days, it raises our cortisol level. That's the stress hormone. And that lowers our immune system as well. So we cannot change the environment around us and what's happening around us, but we can certainly try and change our response to it. And we can do that by a few things, which is to really be mindful of our media diet. Media is good. We need to be informed, but at the same time, it does not help to have a constant notifications coming or constantly having any of the cable TVs on all the time that always bombard us with these stories that are very necessary to be told, but at the same time, it doesn't help if we're doing it 12 hours a day. So with just a handful of those tips, making sure if it's a nice day outside to sit outside in the backyard and get some vitamin D from sunlight, great immune booster. Making sure that you use your basement or your TV watching time in front of TV to exercise a little bit more, at least 15, 30 minutes a day, gets the blood moving, great immune booster. Simple steps, making sure we cut down on smoking. And especially for stress relief, folks, often turn to, cigarette smoking or perhaps a beverage or two in the evening. Alcohol suppresses immune system as well. So I'm not trying to be a killjoy, but certainly these are the simple steps we can take that gives our immune system the boost it needs, especially in the time of the coronavirus. It's great year round, but more so even right now. I hope
Uh,
that helps.
Oh, you've been terrific. Thank you. Thank you very much. And I'll see if we have any more questions.
I'll be on standby, sir.
Okay. Well, thank you very much for that. I just want to kind of let everybody know a little bit about the process that I'm going through as a senator. The governor, as you know, is coming on every day between 4 and 6 or 7 o'clock, and he's giving updates as to kind of the scorecard as to what's happening around the state. And he's also providing us with his guidance of executive orders and things that he's putting in place and his administration is putting in place in an effort to try to combat this, to try to stop the spread, but also to be mindful about important things that need to go on, such as education and teacher salaries and all kinds of things. I make on my website, senatorformica.com, every one of the governor's conversations and press releases and executive orders. It's all there if you want to read it. Feel free to do it. He gives us the daily numbers. I just did get the numbers for today, and I will share them while the doctor is on. There's now 3,824 total positives in the state of Connecticut, which is that's 267 higher than yesterday. There has been 827 patients are now currently hospitalized. That's one of the things that you said, Doc, that we need to watch out for. A lot more testing, going on. 18,300 people have been tested since that's an upward of 1,700 since yesterday. And then, very sadly, there's 27 new deaths since yesterday. So that's the bad news and being mindful. That will be all available on the governor's press release, which he's on now, I believe, and we'll have that on our website. But we did get one question that just came in, Doc, about homemade masks. We see a lot of people knitting, sewing, making masks, and putting them. Is that effective?
Yeah, certainly, especially if it's a clean material that's easily washable. It makes sense to, make a nice fit to your own face shape and size, either with a bandana simple as that, or with an elastic band that people are doing, cottage work at home, and many of them are supplying it to other patients or cancer centers, similar to the shawls or the caps for chemotherapy patients. So it really energizes a whole community to come together to do a small act, but powerful act of contributing to this pandemic response. And I would say look out for your neighbors, see who is in need, and perhaps start sharing those homemade masks locally. Hospitals, they need a different grade of masks, and even the hospitals are accepting homemade masks these days, which is a whole different story and is not our main focus right now.
Because the homemade mask will protect you from getting anything out, but also protects to a certain extent people having anything come in. As long as be careful, you don't mess around with it with your hands a lot, and you take it home and you sanitize it at some point, right?
Exactly. It doesn't absolve us from the responsibility of hand washing and social distancing, but it just puts an additional layer for the virus to get through or come out.
Okay, thank you very much.
Thank you.
Let's just talk about a couple of opportunities and links. Many of you out there are participating in a 12-step program. Those are being held off now because of the crowd. So if you need online assistance for a 12-step program, intercommunity healthcare, recovery at home, Their number, it will be on my website, but it's 860-569-5900. And you can go to aa.org or na-recovery.org. And if you go to that intercommunity healthcare website, you'll see a number of websites that you'll be able to go to find some resources that may help you get through these times, because these are stressful times. And also, a volunteer, the 211 hotline and website has been directing callers in ways to help to help in their area. We have a dedicated page with all of this information, plus specifics pertaining to where you can help out specifically in the 20th district. There are volunteer opportunities and for medical volunteers. Connecticut's hospitals and nursing homes and medical facilities are in desperate need. They will help you work as a volunteer and be safe for both the people you're volunteering for and for yourself. Many food pantries, soup kitchens rely on volunteers. Again, there are ways to participate in that and being mindful of the social distancing. Donation opportunities, there's blood donations, medical supply donations, monetary donations. All of those things are listed on my website in ways that you may want to contribute and not actually go out into the community. There are business, as we know, this is having a devastating effect on our economy. We were sailing along, everything was going fine, and all of a sudden now we have to be mindful of health first, business second. So while those essential businesses are open and are doing probably 20% or 10% of the capacity of business they used to do, many are closed and many are in trouble. There's opportunities on my website to find out about the SBA, which is the Small Business Administration, and the latest one we want to ask questions on, it looks very promising to me, is the CARES Act, C-A-R-E-S Act, and it goes Paycheck Protection Program, PPP. It's a simple online application. There's $350 billion that have been made available for this funding by the by the president and the United States Senate and House. And that is able now to be distributed. The applications will start tomorrow, that is Friday, April 3rd, and they will be able to register for that program and then apply to your banks, provide the information that you need. It's basically having to do with payroll records, and the idea is to keep people working. That's why it's dubbed the Paycheck Protection Program. It does provide small businesses, nonprofits, and other entities zero fee loans up to $10 million based on your average monthly payroll costs. So there's opportunity there. There's information on my website about that. Again, fill out the application, have your supporting documentation, your bank, make sure that they're FDIC bank, and they will be able to help you with that. And these details are rolling out over the next few days. The SBA loans, there's a number of SBA loans opportunities and emergency economic injury grants. All of those details are available on a link on my website so that you could find it. There are refundable tax credits. Also, it deals with deferring payroll taxes. There's a lot of opportunities that are being made to us as business owners to try to help with our recovery as we get through this. The state of Connecticut put out a program that they were going to provide relief for small businesses. They had 25 million. I think it quickly jumped to 50, and then it closed out because of the demand. So I don't know what the status is on that. My understanding is that's on pause, and they're evaluating all of the applications that they did have. So the Federal CARES Act, I think, is the one that people should be looking at now. Again, you fill out the simple form, you do your math, and you can, starting tomorrow, begin that application process and work with your local bank. Doc, there's a question that just came in. We talked about volunteers a few minutes ago, and donating blood was one of the things that people are in need of, and were asking us to come out and donate. Does that affect your immune system? Are there any dangers in donating blood? I'm sure you have to get tested. So can you speak a little bit about that?
Sure thing. First of all, thank you to your listeners who are actually blood donors. They are truly heroes. They save multiple lives. Um, in my prior role in the critical care unit, um, it becomes absolutely vital sometimes to use blood products. We try not to use it unless we absolutely have to. But in spite of the coronavirus, there will still be trauma. There will still be cancer therapy. And those patients will need the life-saving blood products. So thank you for donating blood, especially in the pandemic time. Even though with blood donation, there's a slight drop in the immunoglobulin, but it's only for a few days. And the short answer is it does not impair your immune system. Some people even believe that actually it helps them feel healthier. So continue. If blood donation is your habit and a practice, we salute you. And I would encourage you to continue donating to the American Red Cross, because the overall blood supplies are running really low.
Perfect. Thank you very much. Thank you for that question. And thank you, Doctor, for the answer. Back to the economics. The federal government is giving the taxpayers a 3-month reprieve to pay income taxes and filing up to July 15th. And the state of Connecticut Department of Revenue Services is also extending the filing and payment deadline for personal income tax returns to July 15th. DECD, which is the community of the Connecticut Department of Economic and Community Development, is launching the COVID-19 Business Emergency Response Unit, and it will be dedicated to help businesses throughout the state of Connecticut. So that is also on my website. Unemployment, there's been a lot of questions regarding unemployment, who is eligible for unemployment. The Department of Labor is suspending the requirement that workers applying for new unemployment be actively searching for work. There's a whole laundry list of things that they're talking about with regard to filing for unemployment. So you can find information and a link on my website there. And remember, I'll remind you, senatorformica.com is the website where the links are. If you go to one of these links and you still have questions, I have the best aide in the state of Connecticut, Kim. She will help us bird dog down any information that you have and get some answers to these questions that you may have as a result of further looking into some of these problems. The federal stimulus package, I talked a little bit about the CARES Act and what it could do for business. It also contains the following major provisions: checks of $1,200 per adult and $500 per child to American workers making less than $75,000 or under per year, or households making less than $150,000 per year. And to obtain this funding, you must need to have filed your taxes or must file immediately. So there's been an expansion of the unemployment insurance opportunity, including benefits for 13 weeks plus an extra $600 per week, and expanded eligibility for gig workers, self-employed Americans, and contractors. Again, that information on my website. Again, the CARES Act talks about $367 billion in forgivable loans for small business. And that is if you are eligible for a loan, if you do go through your bank, an FDIC bank, and they provide you the loan through the Small Business Administration, and the purpose is to keep people working. If you do so for a period of time, that loan, even though it's at 0.05% interest, could turn into be a grant or a forgivable loan if you can show your payroll records that you kept people at work. So I think it's a great opportunity. uh, for small business throughout the country, but certainly here in Connecticut in the 20th district. There's 500 billion in federal and treasury lending to larger businesses, 130 billion for hospitals, 150 billion in state, local, and tribal stabilization funds, and roughly 200 billion in additional appropriations. So that's a bit of the economic news for the CARES Act, or the Payroll Protection Program. Mental health resources. There were some questions regarding that. I posted a number of things on senatorformica.com. There is an infographic from the Commission on Women, Children, Seniors, Equity, and Opportunity, which includes hotlines, resources, and pointers on how to get help and how to support others. The good doctor talked about stress, and that being one of the drivers to be susceptible and to help our to hurt our immune system. One of the things we have to be mindful of are the stresses of this situation, being cooped up in our house, being forced into an environment and a situation that we probably haven't been forced in. People, there are home givers and caretakers that are used to being home, and there are people that are used to being out in the workforce and may find the confinement of being at home, even as much as they love the people they're with, to be rather unnerving, and so it can really play on people. So make sure that you go to this information that we have on our website if you need help, and mental health resources is very important too. We have some great nonprofit and providers here in the 20th district, and so that information will be available if you need it. Seniors, how do we safely help seniors during the pandemic? Some of our older residents don't drive, and they need regular assistance just with simple tasks around the house. We want to make sure they're doing well, but we also want to make sure to keep them safe, because one of the things, maybe we can bring the doc back in and talk about older family members. There's age-specific hazard points, I guess, if you want to call that. People over age 70 seem to be more susceptible to this virus, and maybe their lungs are a little older, a little weaker, and people that have marginal health issues, that maybe have had surgery, maybe who smoke, maybe you have other issues that might be. But seniors, if you're in good shape and good health, you need to still be careful, right?
Certainly. Because as we all age, immune system has a natural tendency of going down. That's just part of natural aging, senescence. Having said that, we treasure our elders and seniors, and if we can do, any small acts within our own family or around us in our neighborhood, so that they don't have to go out, that perhaps is the best gift that we can give right now. If we are not able to do so because of distance or other factors, certainly calling up on them, if they are family or friends or neighbors, having a human connection by using technology, either by phone call, or if they are tech savvy, and most of the seniors are, use FaceTime, Skype. That visual connection is powerful, and reducing isolation and loneliness goes a long way towards well-being. Great point, Senator.
Good, and I know the great folks that handle Meals on Wheels are out there. That they could use some help to try to get these meals to these seniors who sometimes don't see anybody else during the course of the day other than the delivery person of Meals on Wheels. So there's ways to help seniors, and there's information about that on my website. Thank you, Doc, for being specific about that. We want to make it easy for vulnerable individuals to remain at home, and the doc talked about how can you assist with shopping and any other errands and things that you can do. Cybersecurity. cyber safety best practices for working remotely. Many of you are working from home for the foreseeable future. Several people maybe for the first time, and it's more important to practice cyber safety, especially if you're not used to working remotely. You need to be vigilant. Employees can take steps that will not only help to protect their devices and home network, but their companies. Now, a lot of people, a lot of companies are sending their workers home and having them work remotely, and so their websites and their connections are definitely need to be protected as well. So be especially wary about questionable emails, links, and text messages related to COVID-19. There has been a rise in cyber scams exploiting this virus. I mean, here we are in the middle of this huge pandemic and crisis, and there are still criminals out there who are trying to exploit those people most vulnerable. I think that's rather sickening, but that's out there, and we have to be mindful for it. Many are specifically targeting people working from home. So make sure you verify by phone any requests or links, even if the sender seems to be familiar with you. Some other cyber safety tips include reset frequently used passwords for your email account and router every few months. Strong passwords are long, and avoid common phrases. Double check URLs to ensure that they make sense and match the domain of the company's main site. And look at the far left of the address bar for the padlock icon to indicate a secure connection. Common signs of a phishing email or a sense of urgency. Click here to sign in now, for example, or requests for money, wire transfers, or personal data, and any uncharacteristic language or typos. Never trust links and emails, even if the rest of it looks pretty legitimate. Keep your devices secure by always locking or logging off your computer when you walk away. And so cybersecurity, there's information about that on my website. It's just another thing we need to be cautious of. And we talked a little bit being aware of scams, and watch for emails claiming to be from the Center for Disease Control and Prevention, or experts saying they have information. There are other places that you can go and use trusted sources, such as legitimate based information on COVID-19. So that information is on my website. You can talk about that. Education, distance learning resources. Moms and dads that are home with kids now because our schools are closed, are finding themselves to be teachers, homeschoolers. And, a lot of us aren't trained for that. And, sometimes, our kids aren't the best students and the parents aren't the best teachers, and we have to learn patience. But there are some distance learning resources that I've made available on our website, senatorformica.com, to all the parents and to the kids. It's a huge challenge. There is a list of programs on there that we think might be helpful. These have been vetted by educators and parents, and these services are mostly free. Also, there's a page on the website linking to an entire series of iconic Connecticut parks, museums, and churches that you can take a virtual tour of while you are responsibly social distancing. So while you may think, geez, it's nice to go out and go for a walk in a park, what's happened is in a lot of the state parks, a lot of the town parks have been overcrowded. And so now, while we're trying to social distance, the parks are open, everybody's going to the parks. We've had to close some of the parks because there's just too many people going there. We want to make sure that everybody's safe. So here's a way you can take a virtual tour, parks, museums, churches, many items that you can go on there. You can even get on, you can even get to the Mystic Seaport on one of those and have a wonderful tour of that fantastic facility. There are some other questions that have come in. One just came in now, trying to support local business, ordering food delivery. How do I ensure my meal is safe? Um, as a food professional myself, I can tell you that you take great pains to source food now, and it's much more difficult to do so. But if you are supporting your local restaurant, your local grocery store, your local market, whatever it is, those folks. You've been with them a long time. You've been supporting them, and they've been serving you for a long time. Don't be afraid to ask the honest questions when you go in there. When did you get this? How old is it? What's going on with that? And I know that they will be happy to answer, because one of the things that service vendors want to do is to make sure that they don't lose your business in the long run by getting it out. So there's a opportunity to do that, and a lot of restaurants and markets and food outlets have closed, rather than to try to just serve takeout. So that's given more opportunity. But I'll talk a little bit about supporting local. Doc, do you have anything you want to add to that? Or
No, I think, as you said, the local prepared foods, especially if it's hot food, the virus does not last. So just be mindful of the interaction around pickup and drop off, and the container safety, hygiene. But as you pointed out, most solid, good local restaurant owners and chefs, they follow safe serve guidelines even without COVID. So that's the best practice. If we can learn cooking from the best, like Senator Formica, maybe he can give us an online class one of these days, and we can get America cooking again.
yeah,
That'll be great.
yeah, that would be good. I think it's a great. In fact, I might be able to share a little bit. I cooked the chili up. I think maybe when we get to the end of this, I'll just give a quick chicken chili recipe.
Love it.
Well, my great assistant Sarah likes this white bean chicken chili. She's dying for the recipe, so we'll be able to get that. But you're right about serve safe. Anybody that's in the food business, whether you're in a grocery store or a market or a restaurant, is required to take a serve safe course, so that they are very, very familiar with practicing serving safe procedures and processes. So many places are doing touchless interactions, where you pull up to the curbside, pop in your trunk, and then somebody goes out and puts the food in there. I would recommend as many, supporting as many of that as possible, because touchless is the way to go. Where you don't even have to sign your credit card, I don't think now, and try to eliminate that, making change. Some of the other questions that we've had. There's a lot of concern about voting. We are in a presidential year, and the state General Assembly is up for election this year. And so, what are we going to do about that? And what is the situation happening for November? And we're a little premature to worry a lot about that, but there are steps being taken now, because it's going to take some planning. The primaries have been moved. The Secretary of State is working with the governor and the legislative leadership to move the presidential primary to June 2nd, and hopefully a lot of this will be biased. And we and the legislature are mindful of your concerns and want everybody to be able to vote. And the more we get good at technology, the better we can be in fine-tuning remote or absentee ballots. And I think that's a good opportunity. There was a question, actually, I want to finish a thought on that. I think there will be a lot more conversations to come. We get through this peak the doctor talked about the last 2 weeks of April, and then we can really think about working with the municipalities on how we do this safe voting. And by the way, on my website, senatorformica.com, there's a link to every town in the 20th district. So if you live in any of the 8 towns and you want town-specific information, follow the advice of your mayor, first selectman, or local health professional. You can access that link for your town on senatorformica.com. There's been conversation about COVID being in the correctional system. There's been a case or two, I believe, in one of the facilities. So there's been some questions about early prisoner release. That's really the governor's call at this point. I don't know that's really been talked about beyond what the governor can do. And there may be some opportunities for lower level offenders to be released. And I'm sure that conversation will get stronger as things move forward. Enforcing social distancing. There's a question about blocking our borders. Why don't we do what's happening in Rhode Island? In Rhode Island, the National Guard is stopping out-of-state plates when they enter the state and saying you must, if you're not just driving through, if you're going to spend some time in the state, you need to quarantine for 14 days, and then they let the car go off and on their way. We need to have a better program than that. I think the local communities can be part of a solution with helping that, but we certainly need to make sure that people coming from high infected areas to escape, and you can't blame them for escape. There's a lot of people who live in New York and New Jersey and out of state, even places in Connecticut that are highly impacted, that have second homes in southeastern Connecticut or along the Connecticut coastline. We need to make sure that if you're listening and if you're moving from one spot to another, please be mindful of your neighbors. Bring your food with you for 14 days, and when you check yourself in, stay there and quarantine yourself by sheltering in place for 14 days to keep us safe. There's been a lot of conversations about closing large businesses, the defense contractors around the state, because it's very hard in manufacturing to promote and maintain social distancing. I know the governor addressed that conversation in one of his press conferences a little bit a few days ago. So I know that's talking about, we talked a little bit about state parks and campgrounds and what's happening there. Again, social distancing is the key. Housing issues. The Department of Banking is releasing details, still developing a 90-day grace period for all mortgage payments. There's talk about that, about banks participating in that. Providing a streamlined process for requesting forbearance for COVID-19 related reasons and supported with available documentation. So there are protections if you sign up for that program. Relief from fees and charges, and it won't be penalized by being reported on your credit bureau. So that program is being made available, and I would suggest talk to your bank and find out whether each and any of these programs are a good fit for you. So make sure you read the fine print, make sure you understand what you're getting into, and take the opportunity for the relief if you think that's the best. But again, senatorformica.com is where you can find access to all that information. Nursing homes, I know there's been some talk about nursing homes around the country and here in Connecticut. They are, double focused on making sure that the virus doesn't spread through that. And my understanding is if the state would like to say that if one or person gets tested positive, then the people who are not currently tested positive in that nursing home should be moved to a nursing home that's free of a virus. And then we'll have some nursing homes that are for people that have the virus and others separated for people who don't. So those are conversations that are happening. Again, the governor and the administration are working on that as we move forward. And I think that is the most of what I have for you today. Again, any questions that you think that you may have, please go to senatorformica.com. My email is paul.formica, Formica, at CGA, that stands for Connecticut General Assembly, at cga.ct.gov. Before I talk about, a quick meal that you can feed your family, Doc, you have any closing statements you want to make or any Thank you so much for bringing your expertise here and all the work you're doing to try to keep us safe, and all the people that work with and for you in the hospitals, the nurses, the aides, the orderlies, the doctors, the administrators. They're on the front line. They deserve our thanks and our, and our gratitude because it's tough stuff, and we got to make sure that they have the equipment they need to keep it up, because it's going to get tough, as you said, a couple of weeks from now.
Sure do. And I want to thank Senator for allowing me to participate with you. We appreciate your leadership, and with a steady hand, and as you said, collective action and cooperation, we will get through this. I'm sure of that. And I want to thank, Mashantucket Pequot Travel Nation as well for always stepping up, doing the right thing. And, we'll come out stronger for sure.
We're fortunate we have two of the greatest tribes in the country here, and they've been such good supporters of our communities, and they're both closed down, and I'm sure it's very difficult for the tens of thousands of employees and for the management trying to keep that going. So thank you for what you're doing there. And thank you. And as we get to sign off, remember that we live in the best state, in the best district, in the greatest country in the world. And that's what's going to bring us through this thing. And again, being mindful. So Doc, thank you.
Thank you again.
I'm not really good at this technology, so let me see what I can do. I'm a kind of a little home kitchen cook, and I like to make meals that I can give to my kids, and make meals that last. So what I made today was a white chicken chili. I don't know if you can see that.
Oh, yes.
It's got peppers and onions and chicken broth, and it's got great chicken. And one of the great chefs is Paul Prudhomme. And I don't know if you've ever had one of his cookbooks, but he has something in each of his cookbooks he calls a ligniape. And a ligniape is a little tip, a little something that gives you a little extra edge on making a better recipe. And the ligniape for this is to use chicken thighs, not chicken breast.
Okay.
They're juicier, they're full of flavor, they're stronger, and it gives your chili kind of the best flavor that you ever had. So Doc,
that's the immune booster right there. Immune system booster.
Immune booster, and we're gonna get you a pint of this. Anyway, be safe, be careful, be smart, be distant, and we'll get through this. We're gonna try to do this again. Thank you again to Doc. Thank you to the great staff that I have at Senate Republicans that are helping me put this on, and my daughter, who is 6 feet away from me being a nervous wreck. So thank you all very much, and we'll see you next time.